Ever thought about how bronchial cancer was treated in the past compared to now? Let's dive into this intriguing topic. Bronchial cancer, also known as lung cancer, is a type of malignancy that originates in the bronchi, the main air passages leading into the lungs. It's one of the most common types of cancer worldwide, and its impact on global health is profound. But, like a silver lining in a cloud, the evolution of its treatment has been nothing short of extraordinary. From the rudimentary methods of the past to the sophisticated approaches of the present, the journey of bronchial cancer treatment is a testament to human resilience and ingenuity. This journey not only highlights the advancements in medical science but also underscores the importance of early detection and evolving treatment modalities. So, buckle up for an insightful ride through the past, present and future of bronchial cancer treatment. Stay tuned to discover the fascinating journey of bronchial cancer treatment. Picture this. The year is 1890, and the medical world is just beginning to understand bronchial cancer. In the late 19th century, the concept of cancer itself was still in its infancy. Bronchial cancer, a specific type of lung cancer that affects the bronchi, was simply an enigma. It was a time when the leading cause of cancer was still a mystery. Physicians of the era were aware of a link between smoking and lung diseases, but the connection to bronchial cancer was yet to be solidified. Treatment options during this period were severely limited. The primary option was surgery, but it was often a drastic and risky measure. Remember, this was an era without the widespread use of anesthesia or antibiotics, making any surgical procedure a gamble with high stakes. Surgical removal of the tumor was the mainstay, but it was often only possible in the early stages of the disease. This was a time before the advent of modern diagnostic tools, so detecting cancer early enough for successful surgical intervention was a significant challenge. The surgeons of the olden days were medical pioneers, pushing the limits of what was possible in the operating room. Thoracotomy, the surgical opening of the chest wall to access the lungs, was a groundbreaking procedure of its time, but it was a procedure fraught with complications, and the survival rate was far from promising. Despite these challenges, the medical community of the 19th century was relentless in its pursuit of knowledge and better treatment methods. They meticulously documented their findings, paving the way for future researchers. These foundational studies helped to shape our current understanding of bronchial cancer and its treatment. The resilience and determination of these early physicians laid the groundwork for the medical advances we enjoy today. They understood that knowledge was power and that every discovery, no matter how small, brought them one step closer to conquering bronchial cancer. These were challenging times, but the medical community never stopped learning and innovating. Their dedication to progress is a testament to the spirit of human curiosity and the tireless pursuit of a healthier future for all. As we entered the 20th century, the face of medicine began changing rapidly. The dawn of this era saw the advent of medical techniques that revolutionized the treatment of various diseases, including bronchial cancer. A significant medical stride during this era was the development of radiation therapy. This treatment method brought a new hope to patients as it targeted and eliminated cancer cells while sparing the surrounding healthy tissue. The principle behind radiation therapy was relatively simple, yet ingenious. High-energy particles or waves, such as X-rays or gamma rays, were used to destroy or damage cancer cells. This was a major step forward in the fight against bronchial cancer, as this type of therapy could reach tumors deep within the bronchial tubes, which were previously inaccessible. Almost parallel with the development of radiation therapy, another groundbreaking medical advancement came into the picture: chemotherapy. This treatment method used powerful drugs to kill cancer cells throughout the body. The drugs could be administered orally or intravenously, and they worked by interrupting the cancer cell's growth cycle. This was particularly effective in treating bronchial cancer, as it could prevent the cancer from spreading to other parts of the body. These treatments, although revolutionary, were not without their drawbacks. Radiation therapy often led to side effects such as fatigue and skin changes, while chemotherapy could result in nausea, hair loss, and a weakened immune system. Despite these challenges, the benefits of these treatments far outweighed the downsides. For the first time in history, bronchial cancer was no longer seen as a death sentence but a disease that could be fought and, in many cases, defeated. The 20th century was indeed a turning point in the treatment of bronchial cancer. The advent of radiation therapy and chemotherapy changed the landscape of cancer treatment, providing new avenues for fighting this devastating disease. It marked the transition from a period of helplessness to an era of hope and advancement in the medical world. With these advancements, hope was on the horizon for patients diagnosed with bronchial cancer. Fast forward to the late 20th century, and we find even more improvements in bronchial cancer treatment. The era was marked with a surge of innovations and advancements that brought about a paradigm shift in the way we approach this disease. One of the pivotal developments during this period was the introduction of targeted therapies. Instead of using a one-size-fits-all approach, targeted therapies are designed to attack specific types of cancer cells. This meant that treatments became more precise, effective, and often resulted in fewer side effects. These therapies, armed with the ability to interfere with cancer cell growth and division, offered a new ray of hope for patients. The late 20th century also witnessed the advent of immunotherapy, a treatment that uses the body's own immune system to fight cancer. This was a breakthrough in cancer treatment, as it provided an entirely new way to combat the disease. Instead of directly killing cancer cells, immunotherapy works by empowering the immune system to do the job. Simultaneously, there were significant advancements in surgical techniques. The move from large open surgeries to minimally invasive procedures marked a sea change in surgical oncology. These procedures, often aided by sophisticated imaging and robotic technologies, allowed for more precise removal of tumors with less damage to surrounding healthy tissue. These advancements, while significant, were not without their challenges. Targeted therapies, for example, required a deep understanding of the genetic makeup of a tumor, something that wasn't always possible with the technology of the time. Similarly, immunotherapy showed promise, but it wasn't effective for all patients. And while minimally invasive surgeries had many benefits, they also required a high degree of skill and were not suitable for all types of bronchial cancer. Despite these challenges, the late 20th and early 21st century marked a time of rapid progress and innovation in the field of bronchial cancer treatment. It was a period that set the stage for the advanced treatments we have today. Indeed, the turn of the century marked a significant shift in the treatment of bronchial cancer. In today's world, treating bronchial cancer is a multifaceted approach. The treatment of bronchial cancer has come a long way, with the advent of advanced technologies and a deeper understanding of the disease. The current standard of care involves a combination of therapies, which may include surgery, radiation, and chemotherapy. Surgery is usually the first line of defense, where the aim is to remove as much of the tumor as possible. Radiation therapy uses high-energy rays to kill cancer cells, and chemotherapy uses drugs to destroy cancer cells throughout the body. These treatments may be used alone or in combination, depending on the stage and location of the cancer. However, the real game-changer in the treatment of bronchial cancer has been the introduction of personalized medicine. This approach tailors treatment to the individual patient, based on the genetic makeup of their cancer. By analyzing the genetic changes in the cancer cells, doctors can select treatments that are most likely to help patients based on a genetic understanding of their disease. Clinical trials also play a crucial role in the current treatment landscape. These trials are designed to test new treatments and procedures to see if they are safe and effective. They offer hope for many people and a chance to help researchers find better treatments for others in the future. Whether it's a new drug, a new approach to surgery or radiation therapy, or even a new way to diagnose the disease, clinical trials are the engine that drives progress. In essence, the current approach to treating bronchial cancer is not a one-size-fits-all method. It's a comprehensive, individualized treatment plan that takes into account the unique characteristics of the patient and their disease. The future of bronchial cancer treatment lies in the hands of researchers and clinicians who continue to push boundaries. As we continue to learn more about this complex disease, we can expect to see even more innovative and effective treatments in the years to come. So, how does the past compare to the present in bronchial cancer treatment? Let's take a walk down memory lane. In the olden days, bronchial cancer was a grim diagnosis. Treatment options were limited and often came with severe side effects. Surgery was the primary method of treatment, but it was risky and not always successful. The patient's overall health often deteriorated, and survival rates were dishearteningly low. Fast forward to the 20th century, and we see the advent of radiation therapy. This was a significant breakthrough, offering a non-surgical option for treatment. However, it was a double-edged sword. While it could target and kill cancer cells, it also damaged healthy cells in the process, often leading to other health complications. As we entered the late 20th and early 21st century, targeted therapies and immunotherapies came into the picture. These treatments aimed to specifically target cancer cells, minimizing damage to healthy cells. This was a game changer, improving the quality of life for patients and increasing survival rates. And now, in the present day, we're witnessing an era of personalized medicine. We're not just treating bronchial cancer, we're treating the individual. With advancements in genomics and molecular biology, we can now tailor treatments to the genetic makeup of the patient's cancer. This means more effective treatments, fewer side effects, and better outcomes. But it's not just about the treatments themselves. We've also seen improvements in early detection and diagnosis. With better imaging technologies and screening programs, we can catch the disease earlier when it's more manageable. This, coupled with better treatments, has led to a significant increase in survival rates. Comparing the past to the present, it's clear we've made vast strides in treating bronchial cancer. From limited options and low survival rates, we've moved to a plethora of treatments and significantly better outcomes. It's a testament to the power of medical science and our relentless pursuit of a cure. Indeed, we've come a long way in the fight against bronchial cancer. But what does the future hold for bronchial cancer treatment? The horizon of bronchial cancer treatment is more promising than ever before. It's a fusion of cutting-edge technology, innovative scientific research, and an ever-deepening understanding of the human body that's driving us forward. Let's take a closer look. One of the most exciting prospects on the horizon is gene therapy. Imagine this. Instead of attacking the cancer cells with chemicals and radiation, we could manipulate the very genetic code that governs them. By identifying and altering the genes responsible for cancer growth, we could effectively switch off the cancer at its source. It's like reprogramming a computer virus. This approach could lead to treatments that are not only more effective, but also far less invasive and damaging to the body. Then there's nanotechnology, a field that's sounding more like science fiction every day. Tiny molecular-sized machines could one day be dispatched throughout the body to hunt down and destroy cancer cells. These microscopic warriors could be programmed to recognize and target specific types of cancer cells, reducing collateral damage to healthy tissues. Moreover, they could potentially deliver targeted treatments directly to the cancer cells, making the therapy more efficient. Of course, these are just possibilities. The path to these breakthroughs is paved with ongoing research and clinical trials. Every day, scientists and medical professionals all over the world are working tirelessly to unlock new knowledge and techniques to combat bronchial cancer. Their work is fueled by the collective hope of a world where bronchial cancer is not a death sentence, but a manageable condition. It's important to remember that while we look forward to these advancements, the best treatment is prevention. Maintaining a healthy lifestyle, regular checkups, and early detection are our first line of defense against bronchial cancer. The future of bronchial cancer treatment is exciting and hopeful, and with the pace of medical innovation accelerating every day, who knows what remarkable discoveries await us just around the corner. In the end, the journey of bronchial cancer treatment is a testimony to human resilience and innovation. We have traveled through time, from the olden days to the present, exploring the evolution of treatment for this life-altering disease. We've seen how early understanding was shadowed by lack of knowledge and resources, yet even then, the determination to combat bronchial cancer was evident. In the olden days, treatment options were limited, and outcomes were often grim. However, the seeds of progress were being sown, setting the stage for the advancements of the 20th century. As we moved into this era, we saw remarkable strides in both understanding and treating bronchial cancer. The development of radiation therapy, the advent of chemotherapy, and the refinement of surgical techniques were all milestones in this journey. Transitioning into the late 20th and early 21st century, we witnessed further advancements, with targeted therapies and immunotherapy emerging as potent weapons against bronchial cancer. The present day continues to build on these foundations, offering patients personalized treatment plans based on their unique genetic makeup. This precision medicine approach has transformed outcomes, offering hope where there was once despair. As we compared the past and present treatments, the progress made is undeniable. Yet we must not rest on our laurels. The future of bronchial cancer treatment holds immense promise, with ongoing research into new therapies, and a greater emphasis on early detection and prevention. So, as we conclude this journey, let us remember the resilience and innovation that has brought us here. Let us honor the countless medical professionals, researchers, and patients who have been part of this story. And let us look forward to a future where bronchial cancer can be effectively treated, or better yet, prevented. Thank you for joining us on this journey through the history of bronchial cancer treatment. Stay curious, stay informed, and stay healthy.